Hi, you are watching COVID updates on Voice of Canada, and this is Sana Haroon. Public health experts say at least 80% of Canadians need to be fully vaccinated to keep COVID-19 cases in check. So as demand drops for first shots, communities are finding ways to reach the unvaccinated.
Catch up on your COVID-19 vaccine. The goal is to make it easier for young people to get the shot. In Quebec, only 68% of people between the ages of 18 and 29 have received a first dose. That's the lowest uptake among all age groups. That's the approach Toronto is using. In some neighborhoods this weekend, community workers went door to door in what the city calls its homestretch vaccine push.
When we communicate with the people, we just tell them to don't be scared, don't, the research, and you take the vaccine, we take the vaccine.
Health officials believe Canada is within reach of having at least 80% of the population fully vaccinated, but it will take work to get there.
We really need everyone to get vaccinated, to do both shots.
A message becoming urgent as variants spread.
We've got high rates of immunity through vaccination, but the virus is evolving, making it harder to control for those who are not vaccinated.
And this health expert's concern is for those who can't be vaccinated yet.
The big thing is kids. We can't vaccinate kids under 12. Those clinical trials are not done. And so it's really up to the adults to keep the kids safe. If we can drive the virus out of the adult community, then the kids aren't at risk.
A major push from many sides to avoid another wave of infections.
COVID-19 vaccination rates have started to fall in the US even as the number of cases rise, mostly in areas where vaccine uptake has been low. Officials are trying to incentivize the vaccine, but they say more drastic measures may be needed.
At this weekend's Conservative Political Action Conference, top Republican influencers railed against government efforts to get Americans vaccinated.
They were hoping, the government was hoping, that they could sort of sucker 90% of the population into getting vaccinated, and it isn't happening. Right? There's a
Applause for anti-vaccine rhetoric comes at a time when much of the country is losing ground against the Delta variant, a now dominant strain of COVID-19 in the U.S. The biggest surge in hospitalizations is mostly in southern and Republican states.
It's horrifying. I mean, they're cheering about someone saying that it's a good thing for people not to try and save their lives.
The country's 7-day moving average is climbing, now to over 20,000 cases.
Our healthcare system in Southwest Missouri, we are absolutely stretched, further than we were stretched last year.
In Missouri, almost every new infection is occurring in unvaccinated people. Without protection against the Delta variant, all bets are off.
We'll do everything that we can to help you get back home to your family. But the reality is you may not go home.
Sweetening the shot has worked in some areas. This Oregon University student is the latest American to win $1 million for getting the vaccine.
I never imagined that.
But a jackpot isn't enough to convince the majority. The president's chief medical advisor says that may mean more drastic measures.
The local level, there should be more mandates. There really should be. We're talking about life and death situation. We've lost 600,000 Americans already, and we're still losing more people.
An epidemiologist and infectious disease physician answer questions about safely adjusting to life as COVID-19 vaccinations rise and restrictions are reduced.
Not right now. It's important to understand that before Delta, there was a fair chance to get back to something which looked quite normal already, in the next few weeks or months. With Delta now, there's an additional bump, and we just need to adapt to it.
Community to the next. I think, Canada is not a homogeneous place. There's a lot of different dynamics going on. So I think it's going to be dependent on, what the rates of Delta and your case rates look like in a given community, as well as what your vaccine uptake looks like as well. So here in Saskatchewan and in our neighboring Alberta, things have opened up pretty much completely. Our vaccine uptake has been reasonable, but we're still lagging behind the rest of Canada. So, depending on your risk tolerance, there may be a role, to consider continuing to be cautious, as well as considering, simple measures like continuing to mask in indoor public spaces, and to consider sort of continuing to kind of restrict gathering sizes and so forth for a little while longer until we get a better sense of what Delta is going to do in Canada. That's going to make a big difference. Meeting people outdoors is going to make a huge difference versus being indoors. And so, the highest risk setting remains, meeting people unmasked, in crowded indoor public spaces. Those are the types of settings where, again, if you're fully vaccinated and you're going to be with other fully vaccinated people, your risk is low. You probably don't need to mask in that setting. But if you're going to be, in a big crowd with a lot of different people, you don't necessarily know who's been vaccinated, who hasn't been, and that may be a place where it might make sense, to mask and be more cautious.
Now, with our stubbornly stable Delta here in Ontario, and this is different in Saskatchewan, for example, we just need to continue to be careful. This means, you will need to ask the questions, are you fully vaccinated or not? This will play a role. And you need to look into how well is the place you're working in ventilated. And in many situations, there will still be the necessity for masks. That's really, really important just to understand. If we just would go back to completely normal right now, we could be in trouble very soon. If you want a proof of concept, go to the UK, the Netherlands, Spain, Portugal, you name it. Opening to the situation we find in a few weeks. So when we go to the next step of the reopening, we need to wait roughly 3 weeks to see what will be happening. And we need to be careful. If this had been alpha, all done. We go back to something which looks quite normal. With this one, it's much, much more important just to stay careful.
Similar. I think, again, a huge part of it depends on your own personal level of risk tolerance, as well as whether or not you've been vaccinated, whether everyone in the household has been vaccinated. So again, that's the first most important piece, as Dr. Uni mentioned, is that everyone in the house who's eligible to be vaccinated definitely needs to get fully vaccinated. That's the key point. And then from there, again, I think taking, precautions depending on what your case rates look like in a given setting, and if you're going to be in a higher risk setting, for example, in a crowded indoor setting or even a crowded outdoor setting like the football game, for example, it might make sense, again, in those types of situations to wear a mask and just take some extra precautions as we kind of give ourselves a few extra weeks, hopefully to get more people vaccinated and get a better sense of what Delta is really going to do to us.
The World Health Organization says getting first doses of a COVID-19 vaccine to everyone in the world needs to be a higher priority than getting booster shots to people in some wealthy countries.
As Pfizer representatives told U.S. health officials Americans may need a third vaccine dose, the World Health Organization expressed outrage.
It doesn't even make any sense.
It's just people who want to have their cake and eat it, then they make some more cake and they want to eat that as well.
Officials argue most countries haven't even started vaccinating healthcare workers yet. Just 1/4 of the world's population has received at least one dose of a COVID-19 vaccine. But in low-income countries, it's just 1%. The WHO says more people need first and second doses to slow this virus down.
At this point, when there is no scientific evidence to suggest that boosters are definitely needed,
Pfizer is citing early data from Israel, suggesting its vaccine protected just 64% of people against all symptoms from the Delta variant. But the data also shows Pfizer was 94% effective at preventing severe illness and death. Israel is now offering a booster to adults with weak immune systems who might be at higher risk for severe COVID-19. The WHO also addressed cases of so-called vaccine shopping, where individuals try to get extra doses of different brands.
It will be a chaotic situation in countries if citizens start, deciding when and who they should be taking a second or a third or a fourth dose.
She said public health agencies can make those decisions. Canada has, and many Canadian experts say, much like delaying second doses, it's a calculated risk.
All the data that's been published thus far says that this should work really well. It just isn't studied in a huge trial way that would make everybody feel more comfortable.
Canada will donate 17.7 million surplus doses of the AstraZeneca COVID-19 vaccine to countries in need and announced a partnership with UNICEF to encourage Canadians to donate money to buy vaccines, which will be matched by the federal government.
Canada has remained steady for many weeks at the top of the G20 and G7 for the share of the population with at least one dose of vaccine.
With such a robust supply and high vaccine uptake, today Canada promised to donate nearly 18 million doses of AstraZeneca vaccine to low and middle income countries. Many provinces stopped offering AstraZeneca as a first dose option, some concerned about a rare side effect. Canada's National Advisory Committee on Immunization also stopped recommending it as a second dose, but the vaccine has advantages for global distribution.
You don't have the ultra cold that you have to have for Pfizer and the very cold, almost ultra cold you need for Moderna.
The federal government also announced it's partnering with UNICEF, asking Canadians to donate shots by giving $10 and pledging to match those donations up to $10 million. Those AstraZeneca doses are slated largely for Latin America and the Caribbean, where the need is dire.
Many countries in Central America and in South America, and even the Caribbean, they are covering only 2, 3, 4% of their population.
Canada's donation will be distributed through the COVAX vaccine sharing program over the next few weeks. But critics say this country is meeting just a slice of a huge global demand.
If you look at trying to end this pandemic from an economic perspective, from a lives saved perspective, or even from a time in a pandemic perspective, getting vaccines equitably delivered to the world early would have shortened every one of those metrics.
Ontario will move to stage 3 of its reopening plan on July 16, 5 days ahead of schedule, but despite the province's improving COVID-19 situations, experts are worried that the spread of the Delta variant.
Coney didn't have to call any of his clients to tell them the news.
We didn't have to make any phone calls. Our phone's been ringing off the hook all day. As soon as they made the announcement, bang, 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 like they're still on the phone right now.
The Ottawa wedding venue owner says after a year and a half and nearly $500,000 in lost sales, he's looking forward to moving events from this small room.
And this is where we shine. This is where we want to put 200 people together.
To this one.
We've been waiting a long time for this. And so have my brides and grooms as well. A lot of parties we have been having to push off. People have been rebooking dates 2-3 times and stuff.
Ontario will move to stage 3 next Friday, 5 days ahead of schedule. Casinos, museums, and movie theaters can also open up. Concerts, festivals, and nightclubs will be permitted with limited capacity. Good news, but with a note of caution.
Folks, this isn't over by any means. We still have a good battle on our hands. So let's not be out there doing a victory lap whatsoever.
Indeed, some Ontario regions are dealing with rapid variant spread, including Owen Sound and Waterloo, which has some experts worried.
That Delta, the variant, is very volatile, very explosive, and we just need to move carefully. We might need to stay in the next step for quite a while. You know, just to basically lift everything is probably far too problematic.
Still, Ontario is in a much stronger place thanks to soaring vaccination rates.
The vaccines have had a massive positive impact. When we start to have close to 80% of eligible people with at least the first dose of a vaccine.
Procurement Minister Anita Anand said Monday the Canadian government would donate a total of 17.7 million additional doses of the AstraZeneca COVID-19 vaccine through the COVAX vaccine sharing program.
The White House has been clear on a COVID booster.
At this time, we don't see the need for it.
But once again, the Canadian government response needs parsing and analysis and can't be summed up in a single phrase.
The Public Health Agency of Canada is doing this work. They are doing the research. They are looking into it, as is the Vaccine Task Force.
Health Canada tells Global News Pfizer hasn't yet submitted a request to approve a booster here, but notes in general one may be required and it's monitoring the need closely. Pfizer tells us it's too early to comment on potential Canadian submissions, but we know it will be applying in the U.S. As for the Vaccine Task Force,
there hasn't been any
official position from the task force or NACI.
This task force member suspects they'll say there's not yet clear evidence a third dose is necessary. But Dr. Andre Veillette thinks some groups could be greenlit before data is in. Those who are immunocompromised or people in long-term care, as Israel and France have done.
Do we need to wait until they start having infections?
There's an ethical dilemma too. The World Health Organization is slamming countries prioritizing third doses over poorer nations without a first.
It doesn't even make any sense.
If we're worried about variants, which is what we should be worried about, the variants are increasingly going to come from those countries where there's large pools of virus. That is where people have not been vaccinated.
Canada is trying to strike a balance, assuring there's enough supply at home if a booster is necessary and announcing more global support. Another 17.7 million doses of AstraZeneca through COVAX and a matching program through UNICEF, up to $10 million.
First time in 60 years, more children under the age of 5 died from preventable causes.
More than half of COVID-19 patients might be suffering from long-term symptoms more than 12 weeks after testing positive, which has been referred to as long COVID, according to a new review by the Public Health Agency of Canada.
36-year-old Adriana Patino used to be the picture of health.
I was a competitive swimmer. I went to 2 world championships with national team, everything. I don't have any pre-existing conditions.
Now, the North Vancouver consultant is among the estimated 500,000 people across Canada who either have or had long COVID, defined as being sick because of coronavirus for more than 3 months.
It's just been a nightmare, being close to dying a few times.
Medically, long COVID can present as an invisible illness. There's no single test to identify it. Symptoms vary from person to person, with fatigue, brain fog, and digestive issues among the common ailments.
I would wake up in the middle of the night and suffocating because I can't breathe. I would fall down because my heart rate was running at 150 beats per minute just walking from here to the kitchen.
Patino has been back and forth with her insurance company for disability compensation for 3 months with nothing to show for it. Patino's grateful for money from friends who started a GoFundMe campaign to help her out. At this point, Patino says her savings are drained. She's making ends meet with money borrowed from her mom.
I'd go into a room, forget that what I'd come for, forget people's names, look at my dogs and wonder, I have 3 dogs, and not remember their names or my son.
Susie Golding founded a Facebook support group for long haulers in Canada. With so little information on the condition, she says the group has been a lifeline to its nearly 14,000 members. Long haulers face an uphill battle when it comes to insurance coverage.
Being something new, it's very right for insurance companies to come to a conclusion, well, there's insufficient medical evidence in support of your claim for disability.
An extension of employment insurance benefits from Ottawa may help, but even though the federal budget promised to extend those benefits from 15 weeks to 26, the changes won't likely kick in until next year. A private member's bill is pushing to extend sickness EI to 50 weeks to help long haulers. But as politicians decide whether or not to extend federal support and compensation from insurance companies runs out or is denied, long haulers say they're slipping through the cracks.
I want people to take this seriously, and I want the government to take us seriously.
A new message from the World Health Organization's WHO chief scientist, Dr. Soumya Swaminathan, created confusion, especially for Canadians, after they advised not to mix and match COVID-19 vaccines, saying there was not enough data to support the medical efficacy of the method.
A little bit of a dangerous trend here.
Cautioning against mixing and matching COVID-19 vaccine brands, World Health Organization's chief scientist, Soumya Swaminathan, cited limited studies.
We're in a data-free, evidence-free zone as far as a mix and match.
In Canada, hundreds of thousands followed the government's recommendation to mix and match. According to the National Advisory Committee on Immunization, or NACI, those who received AstraZeneca for their first dose could safely receive either mRNA vaccines, Pfizer or Moderna, for their second dose. And recently, after a delayed Pfizer shipment, mixing Moderna and Pfizer was also encouraged.
The weighing of risks and benefits was in favor of making sure the population was vaccinated, because COVID-19 in unvaccinated people is a life-threatening disease.
Dr. Joanne Langley adds there is no evidence to suggest a different second dose is harmful. In the UK, a large study proved AstraZeneca and Pfizer have seen success when mixed, prompting a robust immune response. And while vaccine mixing is common with other types of shots, in terms of mRNA mixing, there have been small studies, but no definitive findings yet. Still, Nova Scotia's top doctor says real-world evidence shows it's safe.
There's clear evidence that it is perfectly fine to intermix between the two types of mRNA vaccines. You get the same end result.
What on earth is the public supposed to do with this message?
Bioethicist Carrie Bowman questions the timing of the WHO's comments, which come a little too late for many Canadians.
The risk benefits are not clear enough because of the mixed messages.
Accessibility issues are keeping many Canadians from being able to get their COVID-19 vaccine, and that's why pop-up clinics have been a successful strategy in the country's rollout campaign.
Mona Malcolm has spent weeks trying to coordinate a second COVID-19 vaccine for her 81-year-old mother who received her first dose in May. Getting to a mass vaccination site has been an issue.
I just found this morning.
For 1 week only, Toronto is rolling out 20 pop-up clinics in the northwest part of the city in an effort to increase vaccine uptake across neighborhoods with low vaccination rates. To make them easily accessible, the clinics are located in and near buildings where residents live.
Intuitively, it makes sense that we'll be able to get higher vaccination rates. So the easier we can make it, I think the better for the health of our city.
According to city data, 78% of eligible Toronto residents have received at least one COVID-19 vaccine. About 56% are fully vaccinated. Meanwhile, in Scarborough, where 16 of the 17 postal codes were designated COVID-19 hotspots, the community has managed to reach vaccination rates that are nearly unparalleled in the province, with nearly
we knew we had to get into the community. We had the pop-ups, we have congregate setting. We developed a community engagement group, and we targeted our faith-based leaders, and we brought the vaccine to where our residents were.
This is exactly what Toronto is hoping to achieve in its northeast, where vaccination rates for first and second doses are reach about 20% lower than the city's overall figures.
Service is very good. There is no crowding. Took about like an hour and a half.
I just live nearby, so it's really good that they held it here.
The city says it will be studying results of the vaccine push in the Northwest with a plan to roll out similar strategies in other Toronto neighborhoods to get immunization numbers up and keep COVID infections down.
Keep watching COVID updates on Voice of Canada. For further updates, visit our website voiceofcanada.tv.